Did you know there's a silent condition that could be stealing your vision without you even realizing it? Imagine waking up one day and noticing that parts of your sight have vanished forever. Sounds terrifying, doesn't it? The truth is, millions of people are walking around right now with a hidden glaucoma risk that no one is talking about, and it's robbing them of their sight one small piece at a time. This isn't your typical high eye pressure story. This is about normal tension glaucoma, a sneaky form of the disease that can damage your vision without any warning signs. And here's the kicker, it's more common than you think, especially for people over 60. If you've ever skipped an eye exam or thought, "My vision's fine, I don't need to worry," this video is for you. We're diving deep into the risks, the symptoms you didn't know to look for, and most importantly, how to protect yourself and your loved ones from becoming its next victim. Stick around, because what you'll learn today could save your sight. When we think about glaucoma, we usually picture it as a condition tied to high eye pressure. That's the standard explanation, isn't it? But here's the thing, normal tension glaucoma breaks all the rules. It's the underdog of eye diseases, the kind no one sees coming. Literally. This form of glaucoma can silently damage your optic nerve, even when your eye pressure is perfectly normal. Sounds counterintuitive, right? That's what makes it so dangerous. It's flying under the radar while quietly stealing your vision. So, why isn't it getting the attention it deserves? Well, most eye care conversations center around elevated pressure. Doctors are trained to look for that telltale sign, and patients are taught to associate glaucoma with it. As a result, normal tension glaucoma often goes unnoticed until it's progressed significantly. Think of it as the quiet neighbor who's secretly hosting late-night parties. You don't realize the damage until it's already done. Let me give you a quick example. Imagine Mary, a 65-year-old retiree. She's always had great eyesight, no issues with glasses or anything like that. During her routine eye checkup, her optometrist notices subtle changes in her optic nerve but dismisses it because her eye pressure is normal. Fast forward 2 years. Mary starts bumping into furniture and struggles to see her grandchildren playing on the side of the yard. By the time she gets a proper diagnosis, irreversible damage has already occurred. Her story isn't unique, and that's why this conversation is so important. Now, if normal tension glaucoma isn't tied to high pressure, what's driving it? And who's at risk of developing it? Let's take a closer look in the next section. Normal tension glaucoma doesn't target just anyone. It has its sights set on specific groups, and age tops the list. Once you pass 60, your risk takes a sharp turn upward. Aging brings a host of changes to the body, and unfortunately, the eyes aren't spared. Add a family history of glaucoma into the mix, and your chances rise even higher. If your parents or siblings have faced this condition, it's worth noting that your genetics could be playing a role in your eye health, whether you realize it or not. But the risks don't stop there. Surprisingly, low blood pressure can increase the likelihood of developing normal tension glaucoma. Because the optic nerve relies on a consistent flow of oxygen and nutrients, which comes from a healthy blood supply. When blood pressure dips too low, the nerve doesn't get what it needs, leaving it vulnerable. Heart disease and migraines are also culprits. Conditions that disrupt circulation or create stress on the vascular system can quietly set the stage for optic nerve damage over time. What makes this condition particularly dangerous is its stealthy nature. Unlike other health issues that come with clear warning signs, normal tension glaucoma often progresses without any noticeable symptoms. No sudden vision changes, no pain, just a gradual invisible deterioration of peripheral vision that's easy to miss. It's as if the disease is a silent thief, slowly robbing you of your sight without setting off any alarms. This lack of symptoms can delay diagnosis, making it even more critical to understand and monitor the risk factors. So, what can you do to protect yourself from this quiet intruder? Awareness is key. By recognizing your personal risk factors, whether it's age, family history, or related conditions, you can take proactive steps to safeguard your vision. But how exactly does normal tension glaucoma cause such slow, progressive damage? And why is early detection so vital? Let's uncover the answers in the next section. Normal tension glaucoma earns its nickname as the silent vision thief for good reason. Unlike many eye conditions that make themselves known with sudden symptoms, this one operates under the radar. The damage starts at the edges. with your peripheral vision slowly deteriorating over time. At first, you might not even notice anything. It's easy to dismiss small changes when your central vision stays sharp. But make no mistake, this condition isn't just stealing glances. It's setting the stage for permanent vision loss. What makes this so alarming is the way it progresses. The optic nerve, the crucial connection between your eyes and brain, takes the hit. With every bit of unnoticed damage, you lose more of your field of vision. The changes are gradual, almost sneaky, until one day you realize that you're missing entire sections of what you once saw clearly. And here's the kicker: by the time most people notice, it's often too late to reverse the effects. Now, let's put this into perspective. Imagine driving down a busy street and suddenly realizing you didn't see the cyclist in your peripheral vision. Or reaching for something on your kitchen counter, only to realize it's not where you thought because you didn't see it clearly. These aren't just inconveniences. They're the kind of risks that can seriously impact your independence and quality of life. And all because normal tension glaucoma was working behind the scenes. So if this condition is so silent, how can it be detected before significant damage occurs? That's where regular eye exams become your strongest ally. But it's not just about catching it early, it's about understanding the steps you can take to prevent further damage. Let's explore the power of proactive detection and the life-changing impact of eye exams in the next section. When it comes to normal tension glaucoma, the best defense is a solid offense, and that starts with regular eye exams. Think of these checkups as a critical investment in your eye health. Sure, it's easy to skip them, especially when you're not noticing any problems. But the truth is, normal tension glaucoma often flies under the radar, with no obvious symptoms until it's done considerable damage. Early detection is your only way to catch the silent vision thief before it strikes. During a comprehensive eye exam, your optometrist or ophthalmologist looks beyond the basics of vision clarity. They use specialized tools to assess your optic nerve, check your visual field, and measure intraocular pressure. Even though normal tension glaucoma doesn't rely on high pressure, these tests can reveal subtle signs that might otherwise go unnoticed. For instance, an OCT scan, a high-tech imaging test, can detect early damage to the optic nerve, even in its earliest stages. Now, here's the question everyone asks: how often should you get your eyes checked? If you're over 60, the answer is simple: at least once a year. Think of it like getting your car serviced. You wouldn't skip an oil change and risk a breakdown, right? The same principle applies here. By making eye exams a regular part of your health routine, you're giving yourself the best chance at preserving your vision and catching any issues before they escalate. But remember, an exam is only part of the equation. It's what you do with that information that matters most. If your doctor spots early signs of glaucoma, there are proactive steps you can take to manage it and protect your eyesight. And that brings us to the next crucial question: what can you actually do to prevent and treat normal tension glaucoma once it's been detected? So you've learned about the risks and the silent damage that normal tension glaucoma can cause. But what now? The good news is, there are ways to manage this condition and protect your vision. It starts with a combination of medical treatments, lifestyle adjustments, and in some cases, surgical options. Let's break it down. First up, medications. Eye drops are often the first line of defense in treating normal tension glaucoma. They work by reducing intraocular pressure, even if it's not elevated, to prevent further damage to the optic nerve. Think of them as a safety net for your eyes. But here's the thing: it's essential to use them consistently, just like brushing your teeth or taking daily vitamins. Missing doses can compromise their effectiveness, so if remembering is an issue, setting reminders on your phone can help. Next, let's talk about lifestyle adjustments. Managing blood pressure is a big one. Since low blood pressure can starve the optic nerve of essential nutrients, keeping it within a healthy range is key. Regular exercise also plays a vital role. It improves circulation, which benefits your overall eye health. And don't forget nutrition. A diet rich in leafy greens, omega-3 fatty acids, like salmon, and antioxidants can help nourish your eyes and reduce the risk of further complications. Adding these foods to your grocery list is a simple yet powerful step. Finally, in more advanced cases, surgical options may come into play. Procedures like laser therapy or trabeculectomy can help reduce eye pressure and protect the optic nerve from additional harm. While surgery might sound intimidating, it's often a game changer for preserving vision in cases where other treatments aren't enough. The key is working closely with your doctor to decide the best course of action for your specific situation. Now that you know how to stay proactive and protect your vision, there's one last step that ties everything together. Now that you know about the hidden risks of normal tension glaucoma, the question is, what will you do with this knowledge? Are you ready to take action to protect your vision? Remember, your eyesight is priceless, and early detection is your strongest weapon against this silent vision thief. Schedule that eye exam you've been putting off. It could make all the difference. Talk to your loved ones about their eye health, especially if they're over 60. Incorporate those small yet powerful lifestyle changes. Take that daily walk, load your plate with eye-friendly foods, and don't forget to manage your stress. If this video helped you understand the urgency of protecting your vision, give it a thumbs up and share it with someone who needs to hear this. Let's spread awareness together. Don't forget to subscribe to the channel and turn on notifications, so you'll never miss another life-changing health tip. And before you go, click on the next video that's popped up on your screen. It dives into another essential health topic you won't want to miss.